everyone, welcome to my channel. So this video is solely tailored to ICU nursing interview questions. So first off, congratulations for getting your interview. This is your first step to hopefully getting your dream job. So congratulations. So without further ado, let's kind of get into it. So one of the questions that they usually like to ask is, tell me about yourself. Here you kind of want to sell yourself, so to speak. Mention your name. Where did you get your nursing degree from? Do you have an RN? Do you have a BSN? Do you have a master's? Do you have a PhD? Mention that. Lets them know who you are and what your background is. The other question that they like to ask is, why do you want to work for our company? Why did you pick us? Why us? Here, hopefully you have done your research on the company. So if they are top 10 in providing excellent patient care, mention that. Mention, for example, for 3 consecutive years, you guys have won the award for top excellent patient care, and I want to be part of the culture. I want to be part of this company. I would like to provide excellent patient care. So mention that. It shows them that you have taken the initiative to look up the company, look up what makes them so good and why you want to work for them. The other question they'd like to ask is, why nursing? Why nursing, and particularly why the ICU? Why nursing in the ICU? Why do you want to do it? Here we all know nursing is about providing care. It's a care oriented field. It's a medical profession that provides care to people in their sickest times, to people in their helpless times. This is where you kind of want to mention, it brings out a little bit of your personality. So mention that, I'm a caring person. This is where I feel that I could use my caring skills, my nurturing skills. I want nursing because of this reason. I want ICU nursing because I understand that in the ICU, this is where patients are at their sickest. And I feel that my skills will be better put to use in this conditions. This is why I want to work in the ICU. Mention that you understand that ICU is a high stress environment, which it is. So if you thrive best under stress, mention that. You can mention, I thrive best under stress. I use my nursing skills best under stressful conditions. Mention that. Or mention that you're a detail-oriented person, because that is what the ICU predominantly is. It's very detail-oriented. Things change very quickly. And if you're the type of person that is a little bit obsessive and I need to know this situation, I need to figure out a solution for this, the ICU is a great place for you. So mention that about yourself, why you picked the ICU. This is the reasons why. The other question they usually like to ask is, tell me about a time when this and this has happened and how did you manage that? So these are your behavioral questions. For example, they'll ask, tell me about a time when you've had conflict with a coworker and how did you solve that conflict? They're trying to gauge what type of person are you under adversity, because they understand that in a workplace, not everyone's going to have the same personality. You're going to meet people that you clash with, and how do you handle such situations? So for this, you want to give a very clear example. So tell them what the issue is. Tell them, what did you do to solve the issue, and did it work? Or if it didn't work, what was your next step? The other question they like to ask, which can be a little bit scary, is, tell me about a time when you have had to be corrected, or when you have had to receive constructive criticism, either from your coworker or from somebody higher in power, like your manager. So this question, you don't want to make yourself look bad, so find a weakness. It's more so about your weaknesses. Find a weakness that is still almost a good thing. So let me explain. So for example, I've been asked this question, tell me a time when you've had to have some sort of constructive criticism or an area that you were weak and you needed help with. So I mentioned that I am a very, very caring person, to an extent where I take on a lot. So I care too much. So for example, there's times, you come to work and you take on these patients whether it's an 8-hour shift or a 12-hour shift or a 10-hour shift, depending on the company that you work for. You take on these patients, and these patients become like your children or your babies. You want to nurture them and take care of them. And at the end of the shift, you gotta hand over those patients to somebody completely different or somebody completely new. So you now have to trust that your patients or your babies are going to be taken care of the way you've been taking care of them in somebody else's hands. So here I mentioned, I'm very caring to a point where I get stressed out, and I take on a lot, and I take on those stresses to my other areas in my life. So I take on those stresses home, or I carry them on, and I worry too much, I care too much. But you need to remember that as a nurse, you need to do self-care, because if you are not in a good condition, be it emotionally, physically, mentally, you're not going to be the best nurse that you need to be. If you are stressed out all the time, you're not going to be able to provide this excellent patient care that you want to provide. You're not going to be able to take care of your family at home, or your pets at home, or whatever responsibilities you might have. So that could be a weakness. You care too much, and you need to remember that you need to care about yourself. You need to promote self-care. That could be constructive criticism. I understand that you care too much, and I understand that sometimes you are encompassed by this job, but you need to remember to take care of yourself. I hope that made sense. Another question they usually like to ask is, where do you see yourself 2 years from now? Where do you see yourself 5 years from now? These are mostly short-term, long-term goals. They're trying to gauge, do you have any goals after you get here? What are you looking to do? Or are you just looking to kind of stay in the same position forever? So short-term goals, you can say, I'm in 2 years, I see myself having my CCRN, which is your critical care registered nursing certification. You could also mention, I see myself being a preceptor, kind of training other new employees. For long-term goals, you could mention something along the lines of, I see myself in a leadership position. So for example, I see myself as a charge nurse, or I see myself as a lead educator. I would like to educate people or pass on my knowledge, right? So those are your long-term goals. So these ones are tailored to new grads. So for the new grads, obviously they don't expect you to have prior nursing experience. So in your interview, you could mention something along the lines of your quality improvements, which are your CAUTI and CLABSI, so your catheter associated urinary tract infections, and then your central line infections. The ICU is known to have a lot of patients that have Foley catheters, and they also have central lines. A lot of patients have central lines. So mentioning those quality improvements is a good look. Another thing you could mention are your drugs or drips that are titrated in the ICU. So for example, your propofol, which is your sedative, or your pain medications like fentanyl, or insulin for diabetic ketoacidotic patients. These are things you kind of want to mention. Obviously, you need to know the names of the drugs, but you also need to know what they're for. So yeah, I think I've kind of touched on the basic questions that they usually like to ask and how you could answer those. The last question, before I forget, is they usually like to ask, after all is said and done, the interview, however long it took, 15 minutes, 30 minutes, they usually like to ask, do you have any questions for us? So a lot of the time I used to make this mistake by saying, no, I'm good, you've answered all the questions that I had in my mind. But really, you should ask questions. If not a lot, at least have one question. The reason for this is you've literally just sat for 15 minutes or 30 minutes doing an interview where they're trying to figure out if you are a good fit for them. However, this is now your chance to ask them questions to see if they're a good fit for you, because you're trying to get into a great company, a company that's going to help you grow in your nursing career. So you need to figure out, are they going to help me do that? So a good question you can ask is, what is the culture like? What is your culture like in this company? That's trying to gauge What are they, people that are teamwork oriented, or is each man for himself? Do they promote continuing education, or do they kind of just let you do whatever? You need to figure out, are they a good fit for you? Ask that. It's not a bad thing to ask. It makes them think, and it makes them realize, like, okay, we see this person's trying to figure out if we're good for them. Another question you would also, at least which I asked, was, what qualities have you seen in employees of your company that are very successful? So what qualities have you seen across the board of employees that have turned out very successful in their career working for you? It kind of shows that you want to know what you need to do to be successful. So, for example, if they tell you, we've realized that a lot of our successful employees are all about teamwork. They take the initiative. They make sure their education is up to date. You want to know these things because you're like, okay, cool. I want to be successful. This is what I'm going to do. So yeah, I'm sorry if this video was too long. I hope I helped someone out there that is thinking of, applying to the ICU, or somebody that is having an ICU interview coming up. Hopefully this video helps. And if you have any feedback, any questions, comments, please drop them in the comment section below. And if it has been helpful, or if you think it's going to be helpful for somebody else, please share. And yeah, I really hope you enjoyed this video. And good luck with your interview questions. I hope you ace it. You've done great getting the interview, so good luck. Thanks for watching.